दब क्या आ रहा था, दब क्या देखना है इमरान, मैं इस पे अपना लेके आया था। ये आया ना कि अगर ऑप्शन ना हो तो मुझे स्टार्ट करना, बोलो स्टार्ट करूँ?
मैं करूँ स्टार्ट?
देखिए तुम थोड़ा हमसे ना अलग से बात करना, ये जरा खोलना बेटा।
बहुत ज्यादा बोला है मुझे, मैंने बोला
क्या कर रहे हो? प्रॉब्लम आ रहा है ना, चलो मैं इससे कर देना। क्या बोल रही?
यहाँ पे जो भी डिस्कशन हो रही है प्रोडक्ट है,
माइक बंद कर, स्टार्ट कर दो।
मैंने ना कीबोर्ड के नीचे रखा था वो पेपर, एक मिनट तक इसमें लिखा था और
A very good evening to one and all. Greetings for the Department of Computer Science and Engineering, Jamia Hamdard. Before I begin, I request Mr. Nafizur Rahman, Assistant Professor, Department of CAC, to recite a few verses from Holy Quran.
Assalamu alaikum. Good afternoon, everyone. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يا أيها الذين آمنوا اتقوا الله ولتنظر نفس ما قدمت لغد واتقوا الله إن الله خبير بما تعملون. ولا تكونوا كالذين نسوا الله فأنساهم أنفسهم أولئك هم الفاسقون. I seek refuge in Allah from Shaitan, the outcast. In the name of Allah, the Beneficent, the Merciful. O you who believe, be mindful of Allah and let every soul look to what deeds it has sent forth for tomorrow. And fear Allah, for certainly Allah is all aware of what you do. And do not be like those who forgot Allah, so He made them forget themselves. It is they who are truly rebellious. Thank you.
We welcome you all to an international webinar on digital transformation, facelifting oncology, being organized under the Indo-Egypt series. This event is being conducted under the patronage of Mr. Hamid Ahmed, Chancellor, Professor Iqbal Hasnain, Pro-Chancellor, Professor M.A. Jafri, Vice-Chancellor, and Chairman Professor M. Afshar Alam, Dean, SAST. Our eminent speakers are Professor Naveen Makram Rafi, Sadat Academy of Management Sciences, Egypt, Dr. Yusri Rustam, Professor of Clinical Oncology and Nuclear Medicine, Alexandria University, Egypt, Professor Dr. Ahmed Tadi, Dean, Faculty of Medicine, Delta University for Science and Technology, former President of Military Medical Academy, Egypt. We welcome you all and look forward for your enlightening sessions. In this digital world and the ongoing crisis, we realize that computational techniques can surely change our lives by the diagnosis, treatment, and cure of diseases. With cancer in particular, AI and other computational advances can provide solutions in oncology. We welcome all participants from India and countries like Jordan, Algeria, and Egypt. I now request our mentor, without whose support no event is possible, Professor M. Afshar Alam, to inaugurate this international webinar.
Thank you very much. Good evening, everyone. I welcome everyone to international webinar on digital transformation, facelifting oncology, organized under Indo-Egypt series. I welcome Professor Dr. Levine Mukarram from Sadat Academy for Management Science and Egypt, Professor Dr. Ahmed Taudi from Delta University of Science and Technology, Egypt, and Professor Dr. Yusri Rustam, Alexandria University, Egypt. I also welcome to all the faculty member, participant, and students from India and outside India. I extend my gratitude to everyone for taking out their valuable time to attend this webinar. Facelifting, also known as a technical means removal of wrinkles by surgery to give a more youthful appearance to the face, although the history of this surgery goes back to more than 100 years ago. In recent decade, it has been more popular because demand of being youthful in middle and senile age has increased among people. Due to the contemporary improvement in medical care and increased common knowledge about the importance of healthcare, the lifespan of the people all around the world, especially in the first world century, has been significantly increased. As a result, the common problem associated with the sensitivity have gained more attention. The practice of facelifting has been dramatic transformation in the century since its inception. The knowledge gained from the proceeding surgeons has led to the development of many safe, reproducible, and effective techniques. The technological advances are playing an increasing role in cancer screening, early detection. New technologies have been implemented and used specialized center to facilitate the diagnostic and detection of early skin cancer for patients at high risk. These technologies include digital photography, dromoscopy, computerized image analysis system, confacial scanning, laser microscopy, patient-physician healthcare system. Related to the factor effect, the adoption of new technologies for early detection of skin cancer in a dermatologic practice. There is a need of better understand the acceptability of new technologies in dermatologic practice. Preliminary studies need to be conducted to determine the patient, the physician, and the healthcare system acceptability of new technology for aiding in the detection and diagnosis of the skin cancer. The strategies need to be considered to increase the acceptability of these technologies. The patient satisfaction and the patient-physician communication are inherently difficult to assess. However, they are important factor related to the adoption of technologies. It is important to consider the physician factor. They may affect the implementation of new technologies in a dermatology setting. Physicians have a preference for reliable, efficient, and easy use technology. We have three distinguished speakers who have discussed the digital transformation from the traditional facelifting oncology in the current scenario. We all looking forward, eager to listen them all. Thank you very much, and thanks again, everyone. Thank you very much.
Thank you, sir. People will forget what you said, people will forget what you did, but people will never forget how you made them feel. So thank you, Parul ma'am, and thank you, Shar sir. Your words of wisdom have really enlightened the starting of our international webinar. We now start towards the introduction of our researchers and our speakers. So let's have the introduction of all the three speakers, which will share the insights in this particular webinar. So we go towards the introduction of our ma'am. So I'm sharing the slides for the welcoming of our three speakers. We welcome Professor Naveen Makram Labib from Sagat Academy for Management Science in Egypt. Ma'am has a great research experience and he has got her master and PhD degrees in artificial intelligence from Alexandria University. Ma'am is a member of various referee committees. He is also working towards in IGI Global USA, and her current research group, UNEP, focuses on healthcare informatics. She is also a management and capacity building consultant and a frequent speaker also. Ma'am has various achievements in terms of SAMS, in terms of Ministry of Youth and Sports in Cairo, Egypt, and she is working in coaching and mentorship for the students. Ma'am will be giving a digital info transformation on artificial intelligence in oncology, the in-depth information about it. So we welcome you, ma'am. Glad you are here. Now we welcome our second speaker. We also welcome Professor Dr. Ahmed Tauri from Delta University of Science and Technology, Egypt. Sir is also a great researcher. He's a president of the Military Medical Academy. Sir is a member of Council of Medical Ethics in Egyptian Health. He has a lot of research in control programs also. He's the faculty board of Benassif Medical School, Benassif University. He's also working in conduction of various television programs on plastic surgery. A great researcher, has published a lot of papers. He will be giving information on current challenges facing oncology by the various stakeholders. We welcome you, sir. We are glad you are here. I now request Umair sir. I am sharing the PPT. Umair sir will welcome Professor Yusri.
Thank you so much, ma'am. Welcome Professor Dr. Yusri Rustam. He is from Alexandria University. Next slide, ma'am, please. Can you please turn to the next slide? Yeah. Dr. Yusri Rustam, MD, PhD, Professor of Clinical Oncology and Nuclear Medicine at Alexandria University. He is a fellow at Centre Hospitalier, Loire, France. He is granted Alexandria University Award for his great research, and he was the manager of he was the general manager of One Day Service Center. Next slide, ma'am, please. He has a lot of achievements. A few of them are pointed over here. His research group is UNEP is working.
Thank you, sir. Thank you for this nice presentation. I'm looking forward for a nice webinar with you and for an extended cooperation with your institute. Thank you.
Thank you so much, sir.
welcome Naveen ma'am.
Welcome, dear. Would you please share the PowerPoint presentation?
Yes, ma'am, we are just doing it.
نشوف شايفني كويس ولا لا؟ اوكي نازل ان شاء الله. خد بالك انك ما تطلعش. Jesus.
The PPT is just downloading. You can start speaking. We are just sharing in 2 minutes.
Okay, so first of all, let me thank Professor Afshar for his kind invitation. This is not the first time that we cooperate with his well-esteemed university, so thank you so much. And I'm glad to be amongst experts in this domain, Professor Taudi and Professor Rustam. So I hope it will be a fruitful and beneficial webinar for everybody. Thanks for Dr. Parul. She did a very good effort in organizing this webinar, as usual. So thank you so much. We'll be talking today about the digital transformation and artificial intelligence and its impact and implications in oncology. I'm just waiting for the slide so that I can start the explanation of these different concepts along with the applications.
Shireen, please share the PPT.
Ma'am, I think ma'am has started presenting. That's why I'm not able to. Naveen ma'am, are you sharing? Shall I share?
I will do so because I think it will be easier for all of us.
Yes, ma'am. Although I have now downloaded it, so if you find any problem, then I can share.
Okay, so. Which way is the share? I am. No, it's not working now.
No issues. Naveen ma'am, I am sharing it.
Okay, please do.
Just an announcement for all the participants. Feedback form would be shared at around 5:30 or 6. We'll announce it. All of you are requested to fill in that feedback form so as to get the e-certificates.
Ma'am, is the PPT visible?
Yes, Shireen.
I'm checking. Yes.
Ma'am, I'm just muting from my end, and then you can start. I'm just muting from my end.
Naveen ma'am, is the PPT visible to you?
Yes, it is, but I need to make it
Okay,
slide.
thank you.
Not, yeah. Thank you so much. But I tried. Would you please, Shireen, would you please end it from your side? I will try it again because otherwise it will not be easy to switch between slides and speakers. It's not working from my side. Okay, so please do it and I'll tell you whenever I finish the explanation of each and every slide.
Sure, ma'am, sure.
Okay, thank you so much.
Ma'am, is the PPT visible?
No, and now it's visible. Yes.
Okay, ma'am.
Okay, can we start by the first slide, please?
Yes, ma'am.
Okay. And the first one. Thank you so much. Okay, so usually we start by this slide because we would always like to greet you from Cairo, Egypt, and Alexandria as well, because we have here with us Professor Rostom. So greetings, since that's an international webinar, greetings from Egypt. Okay, our webinar is entitled Digital Transformation, Facelifting Oncology. Would you please bring the next slide? Okay. As you just mentioned and introduced us, we have with us two eminent professors, Professor Taoudi and Professor. I'm Naveen Makram Labib, Professor of Computer Science and Information Systems, and currently sharing the Department of Computer Science in Sadat Academy for Management Sciences. Next slide. Okay. So, before we start, we need, first of all, to define digital transformation. As you know, that's a concept that's being used nowadays in each and every field, but sometimes it's mistaken with other terms such as digitization or digitalization. So actually, digitization is concerned with converting data from analog to digital format, which is only a prerequisite to applying digital transformation. It's not an equivalent term of digital transformation. So usually we start by working on the data, and then we proceed to the business processes in order to be able to apply the digital technologies. Next slide, please. So I selected this definition because I think it goes with our theme and our application, and it's very simple. We're talking about using digital technologies, different digital technologies, in order to create whether new or existing, work on existing processes, culture, and customer experiences. So we need to focus on these three aspects: how to change the business processes from the manual and usual routine work, and how to apply digital technologies in order to enhance these processes. Work on the culture, which is currently an issue for us. It's a challenge as well. We have to create a great customer experience. Since we're talking about oncology, so we're talking healthcare, then by customer we mean the patient. We will be focusing on satisfying our patient and providing great experience to our patients. Okay, why do we go nowadays for digital transformation? We're trying to meet different challenges, different business changes that are currently working, especially after the COVID-19. So we found out that it's not a luxury anymore, it's a must. We need to make use of digital transformation in all fields, or else we will not be able to continue working in any of these fields. Okay, next slide, please. I would like to link our topic to the SDGs, or the Sustainable Development Goals defined by UN in 2015. These are 17 goals that are very important, and they're aiming at achieving these goals in 2030, as we all know. Healthcare is concerned with good health, and healthcare is the goal number 3. And we're using the digital transformation and artificial intelligence in order to achieve this goal, to provide better services when it comes to patients or to any of the stakeholders of healthcare systems. Okay, next. Okay, why are we thinking about applying digital transformation in healthcare? There are many digital health technologies, and they have different aims. First of all, they're trying to provide ways for patients to be able to make an appointment in a very convenient and suitable way. Second, tackling the needs of the oncologist or the medical doctors, if we speak in general. So providing easier access to the right information at the right time for these doctors in order to help them in the decision-making process. Delivering high-quality care at a reasonable price, which is a problem for all countries. We're currently talking today about Egypt and India, so I guess it's a common problem for both countries. And finally, improving the care provided through knowledge generation. And this will be provided by analytics and by embedding artificial intelligence in different applications. Next. Okay. So looking at the cancer care systems nowadays, we have some issues that we need to tackle. First of all, we have the increased cost due to demographic changes, as we all know. And especially in the cancer care systems, that's a must. We need to work towards decreasing the costs, which are already increasing nowadays. Second, the shortage of the trained medical staff, which is a very big problem. I guess that's worldwide. In Egypt, we're also suffering from the same problem. Third, we have an outdated cost reimbursement system that need to be renovated, if we dare say. And finally, as we all know, we have some operational inefficiencies due to continuing the use of manual ways and routine and manual systems in all healthcare systems. As we realize by now that these issues will definitely require system restructuring, not only changing one application or changing the way one of the hospitals is using. Okay, next slide. Okay, now I will leave the floor to Professor Taudi to shed more light on the current challenges that are facing different stakeholders in oncology system, such as the oncologist and the patients.
Thank you, Dr. Levine, and thank you for the chairperson of the this webinar, and thank you for the presentation of mine. Actually, the current challenge facing oncologists and or the stakeholders, which is the oncologist and the patient at the same time, first is the reliability of the geographical data and statistics. We must know what is the incidence of cancer in different governorate. Egypt, where is high or low incidence, and why? That's because Egypt is a very big country. We are now 105 million population, which is from Upper Egypt, which is the south of Egypt, and to the north. We must know the incidence of cancer in each governorate, which is 29 or 28 governorate, and is a percentage of the different carcinoma. It's the same in all over this governorate, or it's quite different, like is still cancer breast is the first and most common cancer in all of the governorate, or its exchange. bronchogenic carcinoma, the carcinoma of the or cancer colon, and so we need to have the actual percentage and the difference between each government and why. The other one is availability of risk factor surveys in each government. Next slide, please. Next. Then, yes, the availability of risk factors surveys in each government. Is it due to environment? Although in the Middle Egypt, and the Lower Egypt, or like in Aswan and all these countries, the environment over there is so good. There is no pollution at all. But still, there's a great number of cancer in these countries. Why? We don't know. Is it food culture? Like I'm saying, they taught us in the medical school that cancer stomach is due, one of the risk factors is the spicy food. Or here in Egypt, we don't have any spicy food with the name of spicy food. All it is a genetic factor, although all the Egyptian has the same genetic code. So it may be there is genetic cause for the as a risk factor for the cancer in Egypt. Next, please. The third is the reason why most patients come to the oncologist at late stage. So most of the cases came to the hospitals or the centers is between stage 2 or stage 3. Is this because ignorance about the disease from the patient, not knowing how whom to go or to help or guide them? Although now in Egypt there is some parts from the from center in Cairo, there is a telemedicine between these center and the far places, like Aswan and in the Upper Egypt. So is this due to poverty of the patient, because they afraid from the expenses of the treatment of cancer? Lack of medical insurance, maybe, but now Egypt starting to cover all over the Egyptian people with medical insurance. Maybe from fear of facing the reality of the disease, and this is a culture point, by the way, because most of the Egyptian, they are afraid from this disease, and they think that it is a disease of end of life. So they fear to be faced by the diagnosis of you have a cancer. Maybe shyness, and this is one another important point with the Egyptian ladies, that they try to undergo examination, especially by the man doctor, for the breast or for the whatever any place else, and the same with the male for the cancer prostate and doing BR. This is shyness for them. Last and not least, the fear of social pressure, which is a very important point in the why the patient come to us in the late stage, because the culture and the misconceived ideas about the disease, as I told you before, most of the Egyptian, they thought that this is the disease of end of life. So socially, they facing that the patient who has cancer, that they are treated by a different way, and they refuse to contact with him. Next, please. The fourth point is the updated treatment studies and research. Up to now, there is no a unique or one protocol for treatment in different centers in Egypt. Which protocol of treatment to give? first surgery or chemo first or then surgery. Introduction of the latest but more costly, and you know that, drugs and its effect on the economy of the country versus the regular protocol. And if we use these costly drugs, the new one, is it the incidence of a mortality rate will be, and survival rate will be better than the regular protocol. So the prognosis of administering of the latest drug will increase the survival rate, and how much it will cost us, and from the economy point of view. Next, please. The follow-up is a very important point now in Egypt, because for the we don't know the prognosis, the exact prognosis of our treatment, because most patients don't follow up after treatment because either they die, which is maybe is the medical, because the medical center is far from home. So again, the cost, and because of the expenses of the treatment itself. These are the most current challenge for all the stakeholders of the cancer patients in Egypt and the oncologists. And leave now the talk again to Dr. Yusri, and thank you again for this fruitful webinar.
Okay. Would you please bring the next slide? Okay. So actually, before Professor Yusri gives us a success story of Egypt in this domain, I just need to explain some trends related to digital transformation. So after listening to the important points, issues, and challenges raised by Professor Taudi regarding the cancer care systems nowadays, we need to think, is digital transformation a potential solution that can solve these or deal with these challenges, or maybe we should include other technologies or other ways? Next slide, please. Okay. So in 2021, that just started, we have some trends related to applying digital transformation in oncology. We thought about focusing on three of these trends: the telemedicine, the data analytics, and the artificial intelligence. So we need to explore how these technologies, how these trends can help achieving a better oncology system. Next. Okay, so by telemedicine, we mean the remote diagnosis and treatment of patients using digital technologies. As you know, this started many years ago, and it's still going on, although it has some drawbacks and some challenges. But nowadays, it's made easier because doctors can communicate with their patients and with their colleagues via smartphones. So that's very easy. This is much easier for doctors to cooperate and collaborate with other doctors worldwide using some telemedicine platforms. So by applying these platforms and just having a smartphone, the doctors are able to do this diagnosis and even recommend treatment to their patients. And this was proved very beneficial with COVID-19, when patients could not really go and visit their doctors. That was a very nice solution for them. Next slide. Okay. Although this has many advantages regarding oncology, it still has some obstacles, some challenges that needs to be tackled. First of all, the legal aspects. Till now, we don't have laws that are suitable to be dealt with when we use telemedicine. So for physicians, they just have kind of fear to make use of this telemedicine since there are no laws to protect them. There are other concerns such as the fear of liability. Some physicians are scared of committing any misdiagnosis with patients since they're doing so over the phone, over the smartphone. And usually the medical doctors prefer to see their patients, to examine them. So it's not only via phone. That's another point. The third point is the constant fear of making less money when allowing your patients to use these digital tools, especially that in some cultures, like in Egypt, for example, when you go for teleconsultation, then the patient is not really convinced that he or she should pay any fees to the consultant, although they had their diagnosis or their treatment or whatsoever. So these are some of the obstacles that need to be tackled if we want really to make better use of telemedicine. Next. Okay. The second trend is data analytics. By analytics, we mean deep analysis using intelligent systems. So we work on healthcare data and we make use of some analytic software in order to provide both predictive and prescriptive analytics, because predictive alone is not enough. It's not only dealing with some patterns or with some evidence that some patterns will happen and then not doing anything. No, we need to combine the predictive and the prescriptive analytics if we need to provide better care for our patients. Next. Okay. So according to ASCO Educational Book of 2019, there are some capabilities of predictive analytics in oncology field. So first of all, the population health management. With these analytics, some researchers were able to identify high-risk cancer patients with a higher chance of readmission after surgery or chemotherapy. And that was a very important point for the oncologists. Second, regarding radiomics, we can see that the field of computer-assisted texture analysis can make use of quantitative data from scans to study tumor characteristics. And that's, again, a very important point for oncologists. Recently, some computers were able to examine differences in lesion of 125 lung cancer patients, and that's proved in one of the researches. Okay, and these patterns can help predict with future patients, and it can be beneficial. Third, in the pathology field, as oncologists must know that biopsy reads can lead to excessive or inappropriate treatment. So it's very important to make use of artificial intelligence algorithms so that they can offer deep insight on biopsy reads. Actually, Google claims that its AI tool has 99% accuracy in metastatic breast cancer detection and can give oncologists more time to focus on other aspects of care. Next slide. Okay. As I just mentioned that predictive analytics alone is not beneficial. We need to combine it with some prescriptive analytics, so trying to find a way to deal with the predictive patterns. So regarding the hospital readmission, for example, we have many standalone applications that can simply display the forecast of patients who are likely to return to the hospital in the following 30 days, along with a few other fancy-looking charts. We can have a better use of the predictor to drive decisions from the same dashboard that has been used before, and to see associated cost simulation. And cost, as we all know, is very important to all countries. Finally, the hospital staff can determine the patients that are at highest risk of readmission and take action to work on this risk, such as emphasizing patient education at discharge or ensuring timely communication with primary care physicians and acute care facilities. So now we can see when we mix between the predictive and prescriptive, we can provide better care to our patients. Next slide, please. Okay. The third trend is artificial intelligence. As we all know that artificial intelligence has many definitions, but for the sake of our presentation regarding the oncology care, we can make use of this simple definition that artificial intelligence is a set of analytic techniques that can deal with large data sets, whether structured or unstructured, in order to offer accurate predictions by finding patterns or by simply classifying data. Next. Okay. AI can contribute in the healthcare reform. How? By embedding the artificial intelligence in clinical workflows and other processes in order to deal with the operational inefficiencies that were mentioned at the start of this presentation, hence improving healthcare systems by lowering costs and automating workloads. If we can do so, then using the digital health model, we can improve the care provided to our patients. Next. If we do so, we can gain some benefits in oncology, such as providing continuous monitoring and decentralized diagnostics, which is very important now with the COVID, improving accuracy and speed of all services provided to the patient, improving healthcare logistics, which is an asset for the other stakeholders, such as the nurses, the medical staff in general, reducing administrative burden and optimizing workflow in healthcare systems, providing decision support for various healthcare providers, increasing safety, decreasing workload, and finally automating the clinical processes. Next. Okay. Now I will give the floor to dear Professor Rustam in order to talk about our experience in Egypt, status of digital transformation and in oncology.
Thank you, Dr. Naveen. Thank you for Dr. Ahmed for the comprehensive and clear presentation. My role now is to discuss what is the current situation and what we have achieved in Egypt regarding these new trends. For example, our current national status of digital transformation attacked the first was the telemedicine. There was an emerging pilot study in remote locations in Upper Egypt, connecting a remote rural area, local hospital. The doctors were able to communicate to a central specialized hospital to help in diagnosis, treatment, and follow-up patients by highly specialized consultant. This proved highly beneficial to support the local doctors and to support the treated patients with improving outcomes and improving healthcare to oncology patients. The other aspect or the other trend was the data analytics. We started a pilot project, breast cancer project, 5 years ago. We collected 10 years data from three major oncology highly specialized centers in Alexandria. We collected the data of about 7,500 patients presented to these three major centers in 10 years. And first we used the common statistical analysis method. Then we subjected this data to the data analytics using artificial intelligence. And a comparative study showed the more patterns. Previous slide, please. Using data analytics, it revealed more and more new patterns. For example, an old belief that more advanced patients were presenting to our centers, but now we see less and less advanced patients with more early patients. We used to say that the oncology care or oncology treatment started late, but now after using this data analytics, we realized that most of the patients were treated within the first month after presenting to the healthcare. The other aspect is in the National Health Insurance Program, which has been adopted 2 years ago by our government. They started with 4 governorates, with starting this experience with very successful results till now, and our government intending to generalize to this national healthcare program to all other governors, which allows more and more oncology stakeholders like patients and physicians to access to better healthcare and alleviating the problem of delaying and insufficiency of treatment means, like inavailability of some medications or delay in the treatment of these patients. Now, with the support to this patient, I think the results of caring to the cancer patients will improve. Next, please. As you all see, this is the third trend. There is many application which has been already in the market serving healthcare in general and cancer patients especially. There is more than 10 artificial intelligence application which can be used in the mobile phones or in other laptops or other computers. These applications, I think with time and with the increasing needs of this technology, will ameliorate the care more and more. Next, please. This is a dilemma. Are oncologists ready for digital transformation and artificial intelligence? As you all know, there is always a resistance against any new ideas and against any new ways of adopting new ways. One of the obstacles is we cannot say not totally understanding, but they are not convinced enough to use the artificial intelligence and to adopt digital transformation. They think that they are breaching patient privacy. As you all know, there is a big ethical dilemma about this issue of digital transformation and making all the data available to anybody. I think we need a better ethical consensus with a better level of authority and security to the data, not to be misused, and to achieve the goals from this digital transformation. Adding to the already highly administrated burdens of electronic health records, this is another obstacle in this aspect. Next, please. What we recommend to build a comprehensive IT platform. First of all, we are trying to developing patient-centric application to follow them across the entire care pathway, and talking common language by standardizing terminology. For example, I can register pain as colic, another physician can register pain as spasm, another one can register it as pain. So we should talk a common language by standardizing the terminology and and as well as building an oncology data warehouse to incorporate all types of patient data to allow for a comprehensive view. As I already mentioned, there should be privilege levels to the medical record to all parties involved in oncology care. I think one of the most important thing is training physician, nurses, and medical secretaries on data collection and registration. As you all know, with the deficiency in the medical staff, time is very precious, and to enter data and to register it in the right way, you need more and more time, which is not really an option for the medical staff. So using and training medical secretaries to enter this data is very important, and we can involve patients and patient advocacy groups as well to direct high-risk population to the right screening facilities to be able to detect more and more earlier patients with earlier disease, which can lead to better care and better prognosis of treatment. And we should be working on transferring our work from statistical analysis to big data analytics to get more and more beneficial patterns of disease incidence, screening, treatment, and prognosis. And this, I think, is very important to build comprehensive treatment or comprehensive cancer care facilities, adopting digital transformation principles. Next, please. Next slide, please. This, I think, is a very important items to be followed as a roadmap by enhancing the care team members, by giving them more authority to address issues without the doctors having to make more clicks on the computer, encouraging the community practices, doing a pilot in a way that's very agile and adaptable, and figure out whether a new initiative ultimately generate a return on investment, and by automation of prior authorization and various payer reporting requirements that do not require manual human intervention, as it may generate a measurable return on investment. Next, please.
Okay, so as you see that we need kind of a paradigm shift in order to implement the digital transformation and to adopt all of its technologies in the oncology field. This will require kind of a match between the needs of different oncology stakeholders and what the digital transformation and artificial intelligence can give them, such as insights. As one of the doctors said, I may not know everything there is about my patient, that I'm learning something from the insights that the AI is providing that I didn't think of, and how do I begin to trust that? That's a very important point and a crucial challenges for us to meet. That's kind of establishing trust between different stakeholders, namely the oncologists in the system and the digital transformation and artificial intelligence methodologies. Next slide. Final word for our presentation is that the technology we use impresses no one. The experience to create with it is everything. Thank you for your attention. And now we need to know if you have any questions. Next slide. Okay, thank you so much. Dr. Shireen or Dr. Parul, I think can handle the question, feedback, the comments, if any.
If any participant have any questions, you can ask our invited speakers. Or you can type in the chat box as well. Naveen ma'am, one question I would like to ask. As we are dealing with number of MTech and PhD students, which tool or which simulation analysis platform we can use in order to get oncology on our research platform? I request all the participants to mute their mic.
Mr. Dept.of, I think your mic is on.
Umair sir, you can just mute the mic.
I muted the mic, ma'am.
Okay.
So you're asking about different software to be used, different function related to oncology diagnosis, prognosis, and so on. Was this the question?
Yes, ma'am. Yes.
Okay. So as we are using different AI algorithms.
Just a sec, Naveen ma'am. Umair sir? Yes. Oh, sorry for the disturbance, ma'am.
No, it's okay. I only realized that I think you did not listen to the last two slides. I was explaining how to do kind of a trust between the different stakeholders in oncology and the artificial intelligence in order to make use of the AI insights. And I think that's related to your question.
Okay, ma'am.
So we don't have one algorithm or one software to follow. Actually, we make use of the tools in order to develop our own algorithm and software. I don't know if that's a nice answer to the question, but it depends on the field. It depends on the function, whether we're tackling early detection, diagnosis, prognosis, treatment. So it differs. There is not one recommended software, if we dare say, but we can make use of different techniques. I think one of the main techniques is the use of artificial neural networks, since it's very good in prediction. And that's one of the techniques that we use in the breast cancer project that Professor Yusri was talking about, because I'm with them. I joined the team with them last year. So we made use of the artificial neural networks in order to get the new patterns and in order to work on the predictive analytics. That was the main focus in this project.
Ma'am, there are a lot of questions arising on the chat box, Naveen ma'am. So Ishli is asking, how can we use artificial intelligence and data analytics in survival prediction of cancer patients?
Okay. Since we're talking about data analytics, so that's deep analysis, we work on huge amounts of data. These data were collected over 10 years. So it had kind of follow-up data, although that's one of the challenges faced as Professor Tao explaining. But in this project, they were capable of collecting these data over 10 years. So after we do so, we work on a kind of predictor. Again, we make use of artificial neural networks. So, as you know, we train the system. So we take kind of 60% of these data in order to make the system learn this prediction, and then test the system using the rest of the data, which is the 40%. Once we do so and we're kind of satisfied with the performance, I mean, we can achieve a good error rate, not a high one. Once we do so, we can start working on the new case in order to kind of predict the survival. That's what we did in the project.
Okay. Ma'am, there are some other questions regarding that. How can we use artificial intelligence and data? Okay. Can the treatment strategies available and protagonized with the AI system?
would you please repeat the question, because I think that Professor Yusri can answer this question.
Ma'am, it is saying that Zeba is asking the question, can the treatment strategies available be protagonized with the AI system, the artificial intelligence systems? Yusri sir, your...
we need to an explanation of this word. I mean, are they talking about the efficiency of this treatment?
Yes, ma'am. They are talking about the treatment strategies. Can they be utilized with the artificial intelligence systems?
Yes, of course. And you have many researchers that have already done so. Again, it's the same thing that we need to use kind of a follow-up data in order to see whether these treatment lines or protocols, and I say in the oncology field, were suitable or not suitable, and why. That's why we make use of both the predictive and the prescriptive. Okay, we need to analyze, we need to know what will happen, and we need to know why this happened. So that's tackling the efficiency of different and various treatments in oncology.
Thank you, ma'am. I think there are more questions coming, and I think the participants are very enlightened with your talks. There's Dept.of who is asking, can we use blockchain technology in healthcare with AI?
Yes, definitely. That was one of the trends that will be thoroughly used in 2021, the blockchain. However, due to the time of the webinar, we thought about just tackling the three trends: the artificial intelligence, the data analytics, and the telemedicine. But blockchain will have a very good impact. IoT will have a great impact as well. The wearable devices used will be very good, the virtual assistants. So we have more trends coming with the artificial intelligence in 2021 that are definitely good and beneficial for the healthcare, not only for the oncology field.
Ma'am, Kashif is asking, how secure is AI technology from the cybersecurity attacks around the world, and how can we secure it?
Again, that's one of the main challenges, as we all know, the security, the data security, and the protection of the patient data. And I think that Dr. Yusri Rostom has mentioned this, that we have to work on multi-level, on different level of access privileges to the data, so that not all of the stakeholders can reach these data. As we all know that the patient has some rights that need to be respected. The medical doctor needs to know, they need to know many things about the patient, or else they will not be able to provide good care for them. The secretary as well, the medical secretary, the nurses. So we need to work on a multi-level security system in order to secure, and on the other hand, to make good use of the provided data.
Ma'am, there is another question by Ashish Kumar Maurya. Do you have any online course on telemedicine, like 2 weeks or 4 weeks?
Right now we don't, although kind of our work and our scope of work in the research group called UNIV, we're thinking about providing some awareness campaigns and some short courses talking about oncology informatics. We will focus actually on oncology, not healthcare informatics, as there are many courses related to healthcare, but we found that there is a great need to explain the concept of oncology informatics, the concept of applying different machine learning in oncology, the digital transformation and other digital technologies applied in oncology, the development of mobile applications. That's one of our hope. We're working right now on thinking about how to develop mobile applications that can be used in an easy way by the patients, because as again Dr. Yusri mentioned, that we need to work on the customer-centric, which is in our case the patient-centric applications. Okay, so we'll be announcing very soon some awareness sessions and some very short courses related to oncology informatics fields.
Ma'am, the questions are raising and the participants are very much enlightened with all your talks. And I think Yusri sir or Tauri sir, if they like, they can, Ahmed sir also can interact. Ishleen Kaur is asking, can we get more details on your project that you are undertook, or any website link you can share with the participants, because they are very enlightened with this particular project.
Okay, right now, as Professor Yusri has mentioned, we already worked on the statistical analysis and the intelligent analysis as well of the data related to breast cancer project, since he's the project manager of this project. And we're actually waiting for some publication, okay, to get the approval. So I think that he can send us a brief. He can now hear us, I think. So maybe he can send a brief of the project, and I can send it to you so that you announce it to all of the people who participated in this webinar, and maybe we'll be able even to get some feedback that will enhance our work. We'll mention as well the publications, the accepted ones, and we'll be waiting for the others that are still waiting for acceptance from different journals.
Ma'am, we are taking the last two questions. Zeba is asking that approximate how much population in Egypt is affected with different types of cancer. And Devdutt is asking, can robots perform surgery as telemedicine or telesurgery?
We have, of course, robots. As for the number of patients and how efficient, eligible, and so on legal, I think that Professor Yusri or Professor Taudi can answer this question better than me, since they are expert in this field. So,
Professor Yusri? So your mic is off.
Okay, Professor Yusri will answer this question, because I guess he's more aware of the numbers.
Yearly, we have about 120,000 new cancer patients yearly. The exact number of how many patients is operated by surgery, I don't have it, but there is a good number of patients operated by surgery, by robotics in Egypt. I'm not a surgeon, I'm an oncologist, but I know this information.
You see, sir, there's again a question coming from Gopal here. Sir is asking regarding what are the major impact of IoT in healthcare industry. Any examples that you can cite?
Sorry?
IoT in healthcare.
Because there is kind of echo, so I don't know if the other professors were able to.
Naveen ma'am, sir is asking about IoT in healthcare industry.
Okay. Again, IoT, just mentioned, is one of the new trends that will be working on in healthcare field in 2021. Till now, no, we don't have a real experience, especially in Egypt, but I think it will be very useful, very helpful, especially now with the coronavirus, and that patients cannot really go meet their physicians, their medical doctors. They cannot even cooperate and collaborate with each other. So I think it will have a very good role, but it's still to be explored in 2021. I don't have a real example related to my country now.
Ma'am, two last questions we can take, because we have populated with huge number of questions. And Manish sir is asking, what are the present and future application of AI? I think this ma'am has a lot of discussed in the in the PPT also. So what are the present and future applications of artificial intelligence in medical oncology? And how effective is AI for early detection of cancer? I think you discussed this also in the PPT.
Yes, I did, and you can check the literature. You will find many researches dealing with this. I think that I did kind of a webinar before. It was focusing on the data analytics in oncology with its 3 types, and it had many details. So let me check after the session. If I can find the PowerPoint presentation, I will send it to you. you can share with the participants, of course.
Okay, ma'am. And ma'am, if you agree, we share this PPT also with the participants, because it was very enlightening session and very researchful PPT that we got to know about everything.
Yes, of course, it's a pleasure to deal with you. So you can share the PowerPoint. It's no problem at all, and it's documented. And with the studies, I have mentioned the reference, okay, so that you can still go on for more details if you want regarding the applications and regarding the research is done in this field.
Ma'am, the last question, this is from one of our students only. Zishan is asking, how can we improve healthcare rate parallel to the cost of AI? Like when we say that AI cost is very much, so how can we improve that in terms of healthcare facilities?
Actually, that's a genius question, because we were the cost effectiveness. As you know, it's cost effectiveness, it's cost benefit analysis. So we need to invest more in artificial intelligence solutions, algorithms, developing more mobile apps and so on in order to help the patients. This will be a very good investment because you will be able to save lives. So if you go with the cost benefit analysis, then I think it's really worth it. For example, if we make use of the data analytics in order to get to know the predisposing factors, the risk factors, I think if we can give the study and enlighten the other people, the patient, the different population, then they will be saved, or at least they will be aware of how to not only save themselves, but how to deal with it in early stages. And not, as Professor Taudi said, coming in a late stage that the oncologist or the oncosurgeon cannot handle. So speaking from a cost effectiveness, not a cost approach, but I call it cost effectiveness, I think it's much worse to invest in having talented people, like, for example, your students work in this field and working on different governmental initiatives in order to make our students and our fresh graduates learn about these new trends and help in providing and in developing more applications, because that's, I think it's the best thing they can do. It's tackling the healthcare system. So we're talking about humans, and that's the most important asset worldwide.
Thank you, Naveen, ma'am. I think the questions are still flooding. Ma'am, if you agree, can we ask 2 more questions if you say so?
Yes, no problem.
Ma'am, Mehvish is asking that how, when we're talking about ML, machine learning, in terms of depression, because these are the things that people usually hide for their privacy and so on. So is there any record or any databases that are dealing with the depression in terms of machine learning?
Actually, I worked in the field of depression and Alzheimer's, but that was 6 or 7 years ago, so I cannot recall now a specific study, but let me check after the session, because it's been a while that I'm focusing only on oncology. But let me check the publications, especially that I have 1 or 2 papers in this field. And again, let's communicate after the session so that I can send you all of these documents to share with participants.
Thank you. Thanks a lot. Ma'am, as we express our gratitude, we will never forget that the highest appreciation is not to utter words, but live by them. So everything you 3 have told us, we will be living by it. And I now call upon Siddharth sir for the vote of thanks.
Thank you so much, ma'am. Respected Hamid sir, Honorable Chancellor Jamia Hamdard, Professor Iqbal Hasnan sir, Honorable Pro-Chancellor Jamia Hamdard, Professor M.A. Jaffrey sir, Honorable Vice-Chancellor Jamia Hamdard, Honorable Chairman Professor M. Afshar Alam sir, Dean, School of Engineering Sciences and Technology, Jamia Hamdard, our valued speakers of this evening, Professor Naveen Makram ma'am, Sadat Academy for Management Sciences, Egypt, Professor Ahmad Tawadi sir, Delta University of Science and Technology, Egypt, Professor Yusri Rustam sir, Alexandria University, Egypt, respected faculty members, ladies and gentlemen, it's my privilege to have been asked to propose a vote of thanks on this occasion. I, Dr. Siddharth Shankar Bishwas, on behalf of Department of Computer Science and Engineering, Jamia Hamdard extends a very hearty vote of thanks to all speakers for gracing our important work and sharing with us your findings and opinions today. I must mention our deep sense of appreciation for Professor Naveen Makram ma'am for her explanation on digital transformation and artificial intelligence in oncology. A big thank you to Professor Ahmed Tawadi sir for his effort towards current challenges facing oncology stakeholders. I must mention our deep sense of appreciation for Yusri Rustam sir for explanation of roadmap for digital transformation in oncology. Finally, I would like to take this opportunity to place on record our hearty thanks to Mr. Gulzar Ahmed sir, Public Relation Officer Jamia Hamdard, Mr. Rahil Beg sir, Public Information Officer Jamia Hamdard for their valuable guidance extended to us. I would also like to take this opportunity to thank our esteemed staff members of Computer Center for perfect logistics support. As you all know, an event like this cannot happen overnight. The wheel starts rolling weeks ago. It requires planning and a bird eye for details. We have been fortunate enough to be backed by a team of very motivated and dedicated colleagues of our Department of Computer Science Engineering, SCST Jamia Hamdard. I cannot thank everyone enough for their involvement and their willingness to take on the completion of tasks beyond their comfort zones. Once again, I want to state that we are most grateful to all our speakers. Thank you so much. Jai Hind.
Thank you so much, Siddharth sir. I would like to announce that for each and every one participants who are with us, please fill the feedback form. I have already posted the feedback form in the chat box. Please fill the feedback form. Thank you.
Thank you, everybody. It was a great pleasure being with you. Looking forward to meet again, either in person or virtually through many coming webinars. Thank you again.
Thank you very much. Thank you, Professor Loveleen. Thank you very much for this wonderful session. So I think all the members have a lot of knowledge. This is the best example of